So good day everyone, my name is Sanchez, BSN1A, and for today I'm going to demonstrate on how to conduct parenteral administration. So under parenteral administration, we're going to perform intradermal injection at the same time for the intramuscular injections. Okay, so the first thing that we're going to demonstrate is the intradermal injections. So the intradermal injection is a shallow or superficial injections of a substance into the dermis, so which is located between the epidermis and the hypodermis. I am already done to perform hand hygiene and privacy for the patient is now secured. So as you can see, I am wearing sterile gloves for the safety of myself at the same time for my patient. Okay. So for this time, let me introduce first all of the equipment that we needed for the procedures. So first, we have the syringes. So these are the syringes. So I have a tuberculin syringe, which is ideal for a skin test. And at the same time, I have for the 5cc syringe with a gauge 23 needles for intramuscular injections. And then we have for the aspirating needles, which is used to draw the medications from the vial, and also I have for the ampicillin 250 mg with sterile water already. And then we have for the cotton balls, so one is soaked with alcohol at the same time we have for the other, it is just a dry cotton balls. We have also for the hypodermic tray, and last we have for the waste receptacle where I'm going to dispose used needles. Okay, so for this time, all of the equipments is now prepared. So now check the doctor's orders on the patient medication administrations record. So this is done to identify what kind of drugs to be given. So all of the equipment is now prepared. So now check the doctor's orders and the patient medication administration record. So this is done to identify what kind of drug is to be given. So I have for the medication tray, I'm going to check for this. Okay. To prepare the medication in an intradermal injection, so first we need to get the tuberculin syringe. So this one is a tuberculin. So the next thing that we're going to do is to open for this sterile package. Okay. And then, okay. At the same time, open for the aspirating needles. So for this time, we're going to connect the tuberculin syringe to the aspirating needles. Secure the connection isn't loose. Okay, so I'm going to set aside then the medication vial. I'm going to open for it. So before we're going to open for the medication vial, all we have to do is to clean with a cotton ball soaked with alcohol. And then we need to dispose this one at the waste receptacle. Okay. Now take the syringe and cut the syringe and then draw some air inside the syringe. After that, inject the air into the vial. And then after that, invert the vial and draw the exact amount of medication needed. top barrel to remove air bubbles. And we have to remove aspirating needles and replace it with a new one. Secure the connection is loose. Okay, so place it in hypodermic tray and discard aspirating needles used into the waste receptacle. So all of the waste that we have used is placed to the waste receptacles. Okay, next thing is to write the medication ticket, the name of the drug, the dosage, so that we won't forget what medications we administer. Okay, so for this time, we're going to transport the medication to the patient. So now, we're going to perform injecting the medicine via intradermal site, and we're going to use green vegetables for administering the medicine. So let's assume that this is a intradermal site of the patient. So first, check the medication order on the patient chart. And then after that, arrange the medication part on a hypodermic tray. So this is the arrangement of the equipment or the instrument that we need for this assessment. And then choose an injection site free of lesions and discolorations. And use antiseptic swab to clean the site. So I'm going to use cotton ball soap with 70% alcohol, and then we're going to rub it circular motion to the the injection site. And then we need to place it to the waste receptacle. Okay. So now remove the cuff and hold the syringe between the thumb and the fourth finger with the needle pointing up. Check for the skin tone of the patient. And then after that, pull the needle very close to the patient's skin. Insert slowly at 5 to 15 degree angles. Slowly inject the medication for this time. Now we do the needles at the same angle to minimize tissue damage and for the discomfort. At the same time, we are going to put for the cotton balls. Okay, pat dry cotton balls and do not massage the area. So all is well. Recap the injection. Return it to the medication tray and dispose it to the waste disposal. So for this time, we're going to encircle site of injection. So now we're done with the intradermal injection. So we are done to demonstrate intradermal injection, and for this time we are going to demonstrate the intramuscular injection. So intramuscular injection is the introduction of medication deep into the muscle tissue where a large network of blood vessels can absorb it readily and quickly. To prepare also the medication in the intramuscular injection, so first we need to get the 23 gauge syringe. This one, we have to open the sterile package. Okay, open automatically, and also open for the aspirating needles. Okay, and then for this time we're going to connect the 23 gauge syringe to the aspirating needles. Secure the connection isn't loose. Okay, so for this time we're going to set aside first, and then for this time we're going to open for the medication vial. Next to that, we're going to clean the surface of the rubber seal using a cotton ball soaked with alcohol. And then after that, we're going to take the syringe and cup the syringe and then draw some air inside the syringe. Cup. Draw some air. And then after that, inject the air into the vial. Then, invert the vial and draw the exact amount of medication needed. For this time, we're going to tap barrel to remove air bubbles. And for this time, we're going to remove aspirating needles and replace it with a new one. Alright, so for this time, I'm going to place it in a hypodermic tray and discard aspirating needles used into the waste receptacle. So I'm going to place it in the hypodermic tray. At the same time, I'm going to put this one, all of the things for the waste disposal in order for us to observe cleanliness. And also write the medication ticket and the name of the drug, the dosage, so that we won't forget what medications we administered. So we have for the medication ticket, I'm going to write for the medication that I'm going to administer for the patient. Okay. So now we're going to transport all of the equipment to the patient. So now we're going to perform injecting the medicine via intramuscular site, and we're going to use the green vegetables for administering the medicine. So let's assume that this is a intramuscular site of the patient. So So the first thing that we're going to do is to check the medication order in the patient chart. Advance the medicine ticket. Then after that, arrange the medication tray on the hypodermic tray. So here are the equipment that you need for the administrations of the medicine through the intramuscular system. Next, we're going to choose an injection site free of lesions and discolorations. And then we're going to use antiseptic swab to clean the site we're going to inject. Using a cotton ball soaked with alcohol. And we're going to wrap it in a circular motion. And then after that, we're going to dispose this one to the waste receptacle. Okay, for this time, we're going to remove the cap of the injection. Okay, so we're going to take our non-dominant hand and we're just going to go to the side where an injection site is going to be, and we're just going to put a little bit pressure and we're just going to pull the skin to the side. Something like this. So this is the skin of the patient. Let's assume that it is intramuscular site. We're going to administer for the medicine. We're going to place our hands something like this, sideward. Advance for the resistance. And then take our dominant hand with injections, the needle, and we're going to go and like we're shooting 90-degree or a dart position. Something like this. So we need to do quickly to cause the patient less pain. So we want be steady. Depress, plunger, and instill fluid slowly over 10 seconds. Okay. So after seconds, we're going to wait for it to let all the fluids go to the muscles. Okay, so for this time, we're going to remove now the injection. So we have to take it out at the same angle, so we have inserted it. Also cover the area with cotton balls. Okay. Pat the side not to massage. Dispose this one in the waste receptacle. Recap the injection. And then for this time, we're going to encircle site applications. So that's all for the parental administration using the intradermal and intramuscular system. So that's all. Thank you.